There are two types of situations. One, you look for a donor that you never knew about to find a bone marrow, and sometimes you get lucky and they could be identical twins. Is that true?
Well, interestingly enough, if you have an identical twin, that might be a good donor for malignant disease, but it might not. The concordance rate, the rate of leukemia in identical twins under the age of 5, is high enough that one would be taking a fairly high risk using an identical twin. In genetic diseases, the identical twin would be likewise affected. Identical twins,
because they would have identical potential problems. Is that what you're talking about?
Well, they have the same. If they were genetically identical, as twins are, identical twins are, they would have the same genetic disease, so they wouldn't serve as a donor. So the best donor is a tissue-compatible sibling, a brother or sister who shares the tissue antigens that are required to match for transplantation. It's called HLA.
Okay. In other words, having the same blood type is not enough. There's other things you would look for, and that would be what?
Having the same blood type is not necessary. As we sit here today, we're transplanting a little girl with aplastic anemia, bone marrow failure, and her sister is a donor. They have different blood types, but they have the same HLA type.
What does HLA mean?
It's human leukocyte antigen, and these are the tissue antigens that permit recognition of the bone marrow by the host and recognition of the host by the bone marrow. If they're not compatible, you can have graft rejection or something called graft versus host disease, where the actual marrow graft rejects the host, a very serious and often fatal condition. So we test only for HLA, and the blood groups are not important.
In an idealistic situation, I hear that only about 70% of people can find a match. Is that true?
Well, it depends where you're looking. If you're looking at siblings based on the size of families and the knowledge that you have a 1 in 4 chance of having an HLA match with a sibling, it gives you about a 20 to 25% likelihood of having a sibling donor. So 75% of individuals have to go outside of their family to find donors. And because of that, what's been established is the National Marrow Donor Program and cord blood programs. The National Marrow Donor Program consists of over 6 or 7 million individuals who have been HLA typed, and if in a computer search they show up as compatible donors, they are willing to donate their marrow to an individual who needs a transplant. And with that, I would say you have probably 70 or 80% likelihood of finding a donor, depending upon your ethnic group. Certain ethnic groups are more diverse and rarer in our population and are difficult to find donors for, and certain of the more common ethnic groups are easier to find donors for. That's why the cord blood system arose. And the cord blood system is really umbilical cord blood collected at the time of birth. The blood is the blood of the baby, not of the mother. It's frozen, and serendipitously it happens to have a large number of stem cells, or cells capable of repopulating an adult marrow. So anybody under about 40 or 50 kilos in weight, or about 80 to 100 pounds, can avail themselves of a cord blood donor.